Good evening. I'm Nima Rajan, and this is Forum Daily for Wednesday, October 19th. And tonight, the National Police Federation responds to the death of yet another Canadian police officer, saying no one should fear their next shift could be their last. It says the stabbing death of RCMP Constable Shaelyn in Burnaby, BC yesterday marks the fifth on-duty death of a Canadian police officer in as many weeks. 31-year-old Constable Yang worked as a mental health and homeless outreach officer. She was working with a city employee at a homeless campsite. This was when an altercation broke out and she was fatally stabbed. All right, switching gears to the latest data on inflation. Statistics Canada says the annual inflation rate dropped slightly, with inflation moving to 6.9% in September. In its latest Consumer Price Index report, the federal agency says lower gas prices resulted in the slight deceleration from 7.0% in August. Gas prices fell by 7.4% in September from a month prior. StatsCan says food prices continued to outstretch the overall inflation rate. This with price increases keeping pace for 10 consecutive months. All right, well, the Insurance Bureau of Canada says an initial estimate indicates post-tropical storm Fiona caused $660 million in insured damage in Atlantic Canada. The estimate was by catastrophe indices and quantification, and if accurate, it would make Fiona the most costly extreme weather event ever recorded in the region in terms of insured damages. But the Bureau says the overwhelming majority of disaster costs will be borne by government, mainly because many of those affected were in high-risk flood areas. This is where residential flood insurance is not available. Prime Minister Justin Trudeau is guaranteeing Canada will meet its latest climate target. Canada has set 8 different greenhouse gas emissions targets since 1988. 6 of them have come and gone without us coming anywhere close to meeting them. The next target is set for 2030, and it requires Canada to get emissions to 55 to 60% of what they were in 2005, which would mean cutting 23 million tons of emissions per year. Mr. Trudeau told the Canadian Climate Institute yesterday that the latest emissions reduction plan, published in March, is accompanied by a plan that shows how to get there. On the East Coast, Newfoundland and Labrador is on track to post its first true surplus in over a decade. The province provided a fall fiscal update today. It shows a surplus of $479 million so far in the current fiscal year. The current budget had forecasted a deficit of $351 million. The surplus is thanks in part to about $400 million more in revenue than forecasted in the current budget, which was from the province's offshore oil sector. Moving to Alberta now, where Premier Danielle Smith has apologized for what she calls ill-informed comments, and she condemned the Russian invasion of Ukraine. In April, Ms. Smith said that she understands why Russia would be concerned with a Western-aligned Ukraine armed with nuclear weapons on its doorstep. Ukraine surrendered its nuclear weapons in the 1990s. On Monday, Alberta's opposition NDP called on her to apologize for her remarks. She noted that Alberta is home to about a quarter of all Canadians of Ukrainian heritage. Turning our attention to the north, where the top city official in the capital of Nunavut has announced that he has plans to immediately step down from the job. Iqaluit Mayor Kenny Bell announced his resignation yesterday on Twitter. He said he discussed the matter with friends and family. Mr. Bell was elected mayor of Nunavut's capital in October 2019. This was after serving as a city councillor from 2012 to 2015. He became a well-known face of Iqaluit's water crisis over the past year. This comes as the city's supply was twice contaminated with fuel. In the latest developments in the Emergencies Act public inquiry, we saw the former chair of Ottawa's police board giving her take on the events that unfolded in February. Former board chair Diane Deans spoke on comments from then Chief of Police Peter Slowly in late January. She says he told her in a one-on-one conversation that he would be very surprised if the Freedom Convoy protesters stayed for longer than one weekend. Now, 3 weeks after that very meeting, Mr. Slowly resigned as police chief, and Ms. Deans was removed as chair of the police board. Canada's chief public health officer says her agency is watching the evolution of COVID-19 variants carefully as infections are expected to tick up. Dr. Teresa Tam says the way variants are mutating appears to be changing. This comes as more people develop immunity to the virus. All right, stay with us. We'll be right back. The latest research on long COVID provides a better understanding for how the condition is likely impacting Canadians and the healthcare system. A recent study published Monday in the Canadian Medical Association Journal has found that long COVID significantly increased doctor visits, home care needs, and hospitalizations for a small number of Ontarians infected early in the pandemic. A similar study by Statistics Canada, also published Monday, indicates the impact of COVID infections varies for those contracting it. StatsCan says this research, in partnership with the Public Health Agency of Canada, is the first national representative report of its kind. Well, joining us now to help unpack this research is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back.
Thank you. Great to be here.
So let's start with the StatsCan study, Dr. Raut. What really stood out to you in terms of information we didn't know about long COVID before?
Right. So there was a lot that stood out actually because it's such a large national representative report. Basically, even looking previous to long COVID, we saw from the rates there almost one third, so 32% of Canadians aged 18 and over tested positive for COVID-19, and then another additional 8.3% suspected they had COVID-19. When we looked at Canadian adults who tested positive or suspected they had COVID-19, 4 in 5 reported having mild to moderate symptoms in their first infection. And then coming to the long COVID piece, what we saw were 1.4 million Canadian adults indicated they had symptoms for at least 3 months after a positive COVID-19 test or even a suspected infection.
That's quite prominent, Dr. Raut. Now, in terms of diagnosing long COVID, can you tell us a little bit more about the symptoms that relate to the condition?
Right. So long COVID is really diagnosed based on a cluster of symptoms. Many organizations like the WHO or PHAC have different definitions for it, but they do agree on a general cluster. Here's what we really know is that we're looking at fatigue, memory deficits, shortness of breath, sleep problems, and joint pain, which is the most commonly found. For Canadians, what we found were 72% who had long COVID had fatigue. The cough was about 40%, shortness of breath another 35%, and brain fog another 33%.
And what do we learn in terms of the Omicron variant and the likeliness of long-term or long COVID developing from it?
So what we know is a very high percentage of Canadian adults with severe symptoms at the time of their COVID-19 infection experience symptoms at least 3 months later, aka long COVID. What we do know is in December 2021, we had this Omicron strain, which became dominant in Canada. This strain was described as less virulent, but much more contagious. Because of that less virulence, we saw is that a smaller percentage of Canadian adults said that they developed symptoms of long COVID compared to the previous strains there. So there was some benefit for sure with Omicron decreasing that long COVID strain.
All right, Dr. Raut. Now, switching gears to the study by CMAJ. Now, that had more of a provincial perspective, but it did give us a look at long COVID's impact on the medical system. So, what stood out to you from this study?
Well, in this study, the authors were really trying to look at the post-COVID burden of health, especially with healthcare use in COVID or community-dwelling adults in Ontario specifically. So they compared positive versus negative tests of Ontarians, and they found a significant higher healthcare usage for people with positive COVID tests. When we say significant higher, we're talking about a large increase to home care encounters, more days in the hospital, and more days in long-term care settings in general. So what we do find is that there's a significant change with COVID versus non-COVID.
All right, and today, Dr. Teresa Tam expressed fears about an uptick in infections during the fall. So, is Canada's medical system ready for the upcoming fall season, Dr. Raut?
Right. So here's what we know worldwide. With the first pandemic wave, as many as 27% of people were admitted to hospital, either died or were readmitted in the first 60 days. And as many as 70% of people were not admitted to hospital, but had at least one symptom 4 months after the infection. So even if we look at the WHO definition, which is 10 to 20% of those infected will develop this post-COVID or long COVID condition, I think we've got to be very careful, and we have to have a much more clearer understanding on how to use our healthcare resources to help these patients as they continue to develop these symptoms.
Always an informative interview. Dr. Raut, thank you again for joining us today on Forum Daily.
Thanks so much for having me.
All right, stay with us. We'll be right back after the break with a look at food inflation and price freezes. Amid consistently rising food prices, some grocery chains are announcing price freezes. But will that help consumers? We'll be speaking with Janet Music from the Agri-Food Analytics Lab at Dalhousie University. And after that, Forum Daily will take a look at the major news stories and headlines from around the world. So stay tuned. Forum Daily will be right back after these short messages. Canadian grocery giants are tackling food inflation with price freezes, but will they be enough? The third largest grocer in Canada says it will not accept cost increases from its suppliers. This will be from November 1st to February 5th to keep grocery prices stable during the holidays. The announcement on Tuesday from Metro came a day after Loblaw said it would freeze prices on all its no-name products until the end of January. Metro says its move will apply to private label brands and national brand products. Meanwhile, Loblaw Companies is raising the supply chain handling fees that it charges suppliers of its grocery and drug stores. But will these moves be enough to support Canadians amid these skyrocketing prices? All right, well, joining us now to talk more on this is Janet Music from the Agri-Food Analytics Lab at Dalhousie University. Miss Music, welcome to Forum Daily.
Hello.
So let's get right to it. Will these price freezes and efforts to keep prices stable for certain products make any difference for Canadians who need relief from food inflation?
Well, Loblaws is committed to keeping prices stable on their house brand, the no frills, that bright yellow packaging. And that really encompasses a lot of the staples, butter, milk, flour. So absolutely, Canadians can take advantage of this opportunity to save money.
And how are these moves likely to impact suppliers and workers amid inflation?
Well, it's interesting because Loblaws is a very strong market player and they control that supply chain, and so often in a lot of those products they have a single provider and likely they'll absorb the additional costs.
And how is this rising cost of food impacting grocery stores themselves? Are they potentially reaping the benefits here?
That's an interesting point. And Loblaws wouldn't probably do something like this if it wasn't to their benefit in some way. Certainly, they're not going to make as much profit, but those are high margin products to begin with that they control. So what's likely to happen here is that they're going to get a bit more of the market share as consumers realize that there's price savings to have, and they switch to those products. Obviously, the retailers are operating in the same kind of inflationary landscape that we are. They're subject to the same pressures, rising gas prices, rising inputs for their producers and farmers. So often those prices get passed on, those costs get passed on to the consumer. So this is an absolute opportunity for consumers to save a bit of money, maybe not as much as pre-COVID levels, but certainly it will have an impact household-wise.
Now, considering that these initiatives by Metro and Loblaw are set to expire in January and February next year, how do you expect prices to look like in the spring season?
Well, the food inflation number came out this afternoon and it was high, so higher than last month. We're approaching the 11% mark. Usually in Canada, prices go up during the winter season. The winter weather impacts the supply chain. Just, regular old blizzards will disrupt some supply chains. We get a lot of food imported into the country during the winter months. So once these freezes are over, prices will remain high. What that looks like, it's difficult to say this far out.
All right. Well, considering that food prices have been rising over overall inflation for 10 straight months, when can consumers expect these prices to reduce back to normal levels, Miss Music?
Well, I think what we're going to have to do is redefine what the normal level is. It's unlikely that we'll go back to pre-COVID-19 levels for some prices. Certainly, climate change is this big X factor that impacts producers across the globe, not just in Canada. And really, inflation is a global issue. Canada doesn't even have the highest food price inflation. The United States is at 13%. So, and then we have these geopolitical issues that impact the supply chain in ways that are not intuitive to the normal consumer. So we have to adjust what the new normal will be, and it's still in flux, unfortunately, until we see some of these events like the war in the Ukraine and these adverse weather events to kind of smooth out.
Lots to keep our eyes on, Miss Music. Thank you again for joining us today on Forum Daily.
Thanks for having me.
Stay with us after the break. We will be back. And when Forum Daily returns, we're going to be taking a look at the major news stories and headlines from around the world. Russia declares martial law in annexed regions of Ukraine. Tensions continue to rise between South and North Korea. Flooding in Pakistan causes $40 billion in damages. And Netflix takes back the crown as the world's largest video streaming service. So stay tuned. Forum Daily will be right back after a short break. Russian President Vladimir Putin has declared martial law in the 4 illegally annexed regions of Ukraine. The declaration gives all regional governors in Russia emergency powers, which open the door to sweeping new restrictions throughout the country. The move comes ahead of an expected Ukrainian counteroffensive to retake the parts of the Kherson region. All right, well, tensions are also rising between North and South Korea, with the North firing about 100 more artillery shells toward the sea. Now, this was in response to South Korean live firing drills at border areas, but the rivals continue to accuse each other of dialing up tensions with weapons tests. The drills conducted by both sides come amid heightened animosities, which are over recent North Korean missile tests that it says simulated nuclear attacks on South Korean and U.S. targets. The artillery firings today were North Korea's third in less than a week. All right, well, turning to the UK now, where inflation accelerated to a 40-year high in September as the soaring cost of food squeezed household budgets. The Office for National Statistics says the Consumer Price Index rose 10.1%. This is compared with 9.9% the previous month. The new data shows inflation returned to the July peak and is once again at its highest since early 1982. The increase was driven by food prices, which rose by 14.5% from a year earlier, which is the biggest jump since 1980. Meanwhile, U.S. President Joe Biden has announced the release of 15 million barrels of oil from the U.S. Strategic Reserve today. This comes after recent oil production cuts announced by OPEC Plus nations. Mr. Biden said in his remarks at the White House that gasoline prices aren't falling fast enough and families are hurting. This comes as his administration rushes to be seen as pulling out all the stops ahead of next month's midterm elections. The Strategic Reserve now contains roughly 400 million barrels of oil, which is the lowest level since 1984. All right, turning to Pakistan now, where the government says the World Bank estimates that this summer's record-breaking floods have caused $40 billion in damages. The figure is $10 billion more than the government's earlier estimate. Pakistan was already facing a serious financial crisis before the heavy monsoon rains hit in mid-June. The rains triggered unprecedented floods. At one point, they left a third of the country's territory submerged. Now, this forced hundreds of thousands of people to move to safer places. A World Health Organization official says experimental Ebola vaccines will be deployed in Uganda in about 2 weeks. The East African country is carrying out tough preventative measures, which include a lockdown in the Ebola-hit areas. WHO's representative in Uganda spoke to the Associated Press on Wednesday and said that potentially hundreds of thousands of trial vaccine doses will support a response effort, which still must focus on tracing Ebola contacts and community engagement. Iranian competitive climber Elnaz Rekabi is back in Iran to a hero's welcome. This was after gaining attention for competing in South Korea without the headscarf required by Iranian law. Women across Iran have been burning their head coverings for weeks. This is in protest over the death of a 22-year-old woman who died in police custody after she was arrested for wearing a loose hijab. Ms. Rekabi issued a statement saying her not wearing the head cover was unintentional. But writer and Iranian-American activist Masih Alinejad says that she believes Ms. Rekabi was pressured into the statement. All right, well, it looks like popular streaming platform Netflix has reversed its recent subscriber losses with gains throughout the summer. The California company has announced that it picked up 2.4 million subscribers during the July-September period. Now, this is a comeback from a loss of 1.2 million during the first half of the year. The performance topped analyst estimates, and it enabled Netflix to at least temporarily reclaim the mantle as the world's largest video streaming service ahead of Disney+. A new study finds that some people really are mosquito magnets, and it probably has to do with the way they smell. Neurobiologists at Rockefeller University in New York found that people who are most attractive to mosquitoes produce a lot of a certain chemical on their skin. They asked 64 volunteers to stick their arms into a controlled space filled with mosquitoes to test the hypothesis. And the results saw several scents tested, with some proving more attractive to the blood-loving bug than others. All right, I'm Nima Rajan, and that'll do it for your look at national and international news for today. Remember, for more news on demand, you could follow us on social media and check out our website. Take care, Canada. We'll see you next time on Forum Daily News.